everyone. Thank you for joining us today for the Impact of Cancer on Fertility. I'm Ann Willis, and I'm the Director of the Center for the Advancement of Cancer Survivorship Navigation and Policy and Director of our Division of Cancer Survivorship here at the George Washington University Cancer Institute. Before we get started, I just wanted to take a couple of minutes to go over a few housekeeping remarks. We ask that you keep your phones on mute to avoid any background noise. And I just wanted to remind everybody that today's program is being recorded. And due to the audience size, we're going to use the Q&A feature for the webinar. So you should see the Q&A box at the bottom right-hand side of your screen. If at any time during the presentation you have a question, please type it in and we will address it during the Q&A portion at the end of the webinar. The questions are anonymous and I will repeat the question. And we will take the questions at the end of the presentation, but feel free to send questions in as we go along. And then as a note before we get started, we will send out a PDF of the slides and a link to the archived webinar, a link of the archived webinar to all of the participants. And then the recording is going to be archived on our website along with archives of our previous webinars. So I wanted to take a moment to review today's agenda. I'm going to provide a brief overview of the Center for the Advancement of Cancer Survivorship Navigation and Policy, and then we will move into the presentation by Ashley Canings from LiveStrong. And then we'll wrap up the webinar with participant Q&A. And just one more reminder, you should use the Q&A box that's on the right-hand side of your screen. So our Center for the Advancement of Cancer Survivorship Navigation and Policy, which we call CA-SNAP, was created in 2009 through a generous grant from the Pfizer Global Health Partnerships Program. And the mission of the center is to advance cancer survivorship and patient navigation efforts locally and nationally through education and training, policy analysis, outreach, and research. The center offers survivorship and navigation resources that are available online at our website and through a monthly e-newsletter. Additional material is sent through the CA-SNAP listserv to over 2,000 subscribers. We write white papers, create case studies, and work collaboratively with other healthcare organizations to advance patient-centered care. And we also share summaries of meetings and roundtables that we've hosted to catalyze patient navigation, cancer survivorship, and other patient-centered care initiatives. Through CA-SNAP, we've offered several trainings, and we were recently awarded funding from the Centers for Disease Control and Prevention that will help us translate our existing in-person trainings to an online format so that we can make them available at no charge to anybody who's interested. So we'll start with our executive training on navigation and survivorship, which is the nuts and bolts training for building and sustaining navigation and survivorship programs. And then we'll also be developing a competency-based patient navigator training that will be available through our online academy. And today's webinar is part of the CA-SNAP monthly webinar series, which we launched in April of 2013. We feature a variety of topics related to navigation and survivorship based on feedback from healthcare professionals across the country. And then we also have several practice-based initiatives that we provide updates on through CA-SNAP. And you can find archived webinars on these results on our website, along with the reports that may accompany them. And our goal really is to share the findings from our research so that we can provide you with information to help you be better prepared to provide patient-centered care. And if there's any topics that you're dying to hear about, we would love to hear from you. Feel free to email us at casnp@gwu.edu. And here are just some more resources offered through CA-SNAP. You can visit our website where I mentioned we have our archived webinars and reports. We also encourage you to check out our free cancer survivorship e-learning series for primary care providers at the link on the screen. So that's cancersurvivorshipcentereducation.org. We've actually had a lot of oncology professionals complete it and find the program really useful. And we recently launched some new modules on health promotion and care coordination, and we continue to add new modules throughout the year. And a reminder, our next webinar will take place on April 16th from noon to 1 p.m. Eastern Time, and it will cover electronic medical record vendor ethics, survivorship tools, and efforts. And then following this webinar, you will receive an email that will have the recording of the presentation, the slides from the presentation, and an evaluation survey to provide feedback on today's webinar. So without further ado, I would like to introduce today's speaker, Ashley Koenings. Ashley is Livestrong's Fertility Services Manager, where she oversees the day-to-day operations of Livestrong Fertility. She has over 13 years of experience in client services and joined the Livestrong Foundation in 2010 as a bilingual navigator, where she was responsible for providing assistance, support, and education to cancer survivors and their families. So Ashley, I will now turn it over to you.
Thank you so much, Anne. I am excited to speak with you all this morning, so thank you for taking the time to listen into this presentation. As Anne mentioned, I have been at the Foundation for 4 years and have had the opportunity to work with our navigation team and specifically our fertility services. Our navigation services at the Foundation are available to help anyone that's affected by cancer be in contact with nurses that can help answer questions about their diagnosis or treatment plan, with patient advocates that can help with insurance concerns or medical bills or any work discrimination issues they might be facing. Also to connect survivors with peers that have been diagnosed with something similar or have already been through treatment, and counselors that we have on staff that are able to provide free emotional support, and we can offer that in person or over the telephone, or also connect individuals with support groups in their own areas. And then specifically with our fertility services, we're able to offer reproductive information, tools, and resources to help patients, and then also healthcare professionals provide timely and personalized fertility information to those facing cancer. So today, our learning objectives, I hope that you will leave today having a better understanding of the need for fertility information and services, that you'll be able to understand the necessary steps to implement a fertility assessment routine, and then also that you'll be able to recommend Livestrong fertility tools and resources to clients or to colleagues, other healthcare professionals that are interested in oncofertility. These are exciting times in both oncology and reproductive medicine. In oncology, improving survival rates have led to a greater emphasis on survivorship, which means late effects of cancer and focusing on quality of life. There have been development of AYA programs for young adults and adolescents, and there's also been increased participation from patients in their own treatment plans and what they want out of their survivorship plans. In reproductive medicine, advances in technologies such as ICSI and egg freezing and tissue freezing have all occurred, which have allowed for more options for patients. So now we're going to start with a video about Sarah that I wanted to share with you all.
Great. So while I set up the video, it's best to either use your telephone or your computer speakers, so you might want to check really quickly just to make sure that your speakers aren't on as well as your phone, or you might get some feedback. Second diagnosis of breast cancer, all of the hopes and dreams that you had for your life and getting beyond cancer just sort of end at that moment. I had cancer about 5 years before I found the lump, so I was really surprised when it came back. My husband and I were getting ready to start a family. We were so excited about our future, bought a new house and had a dog, and we were ready. My best chance for surviving long term was to have my ovaries removed. I thought that becoming a mom wasn't going to be a possibility anymore. I went to see my oncologist. She told me doing IVF, or in vitro fertilization, was an option. We started to get a little hopeful. She connected us with Livestrong. We worked with the navigator to help pay for the medications and services for freezing embryos. And during that time, my sister-in-law Lisa had a dream that she carried our baby for us. She came forward and said, "I'm going to do this for you." She knew how important it was for us to be parents. So she
stepped up and offered. And 9 months later, Lily D was born. I love being a mom and having a family, and it gives me something to think about other than cancer. Even though, there's late nights and little sleep, you just kind of forget about those things. LiveStrong made what we thought was impossible possible.
Right, back to you, Ashley.
Thanks. I love Sarah's story. It makes me emotional, I feel like, every time I watch it. She is a beautiful young woman and has a great story to share, and I've had the opportunity to meet her sister-in-law and her husband and her daughter, and it's just a very special, special story and bond that they all have after going through that experience together. Survivorship, as I mentioned, is increasing. There are more than 150,000 Americans under 45 that are diagnosed annually. More than 26,000 breast cancer patients. Then there's also approximately 13,000 children that are diagnosed, with the most common cancer types being breast, thyroid, melanoma, testicular, cervical, Hodgkin's lymphoma, non-Hodgkin's lymphoma, and colon cancer. 80% survive at least 5 years. Also, as mentioned, the reproductive options are expanding. Prior to treatment, individuals can bank sperm, they can harvest their eggs or embryos, they can do testicular or ovarian shielding, they can do ovarian transposition, moving the ovaries up higher in their abdomen to protect them during treatment. Ovarian suppression or also tissue freezing for testicular tissue freezing or ovarian tissue freezing. Post-treatment, there's also options available. There's testicular sperm extraction, donor sperm, donor eggs, donor embryos, adoption, surrogacy, and ovarian tissue freezing. And ovarian suppression and the tissue freezings are marked with an asterisk because these are still procedures that are considered experimental. So with both the increase in survivorship and the advances in reproductive technologies, there is a growing need for fertility information and services. People of reproductive age need to receive information about their options. So let's go over some of the reasons why this is important. First, to start, there are practical and psychosocial reasons to discuss fertility with patients. The first being delayed childbearing. It's a trend in the U.S. that the average age for first birth for an individual is at 25. In the past, patients of this age may have already had their first baby. Many of these individuals do not already have kids when they're diagnosed with treatment, but they still have a wish and a desire to have their own biological offspring. Those who did not receive fertility information express ongoing unresolved distress and regret even years after treatment's been completed. Among cancer patients, 40 to 80% of women and 30 to 75% of men are at risk for reproductive compromise. Studies continue to show that less than 50% of these individuals recall discussing risks of infertility with their healthcare team. More than half physicians that discuss fertility preservation do not make referrals to specialists and support services. Majority of centers do not have a formal procedure in place for fertility disclosures or referrals. And cancer centers are not utilizing the ASCO guidelines that were created for implementing these types of procedures. A survey of breast cancer survivors showed that 11% of patients received adequate information about fertility preservation from their medical team. Went a little too fast. Oh. Less than 50% of these patients recall discussing risk with a healthcare provider. That statistic is still very alarming because fertility preservation is often possible for people who will undergo treatment for cancer. These discussions need to take place as soon as an individual is diagnosed to offer the patient the full range of options available to them. For patients post-treatment, it's never too late to talk about family building options, especially if they're in the reproductive age. there are women that complete treatment that are still able to preserve their fertility, especially if they're at risk for early menopause. If an individual is deemed infertile, they could look into other options, such as using donor eggs or embryos or sperm, or finding a surrogate, or looking into adoption. So the question is, what's getting in the way of these conversations? There's a quote from the Journal of Clinical Oncology that says, despite a widespread appreciation of the effects of cancer therapies on future fertility, physicians report that a lack of education, resources, and insufficient timelines hinder fertility preservation with discussions with patients. So there's obviously barriers to fertility preservation. The first, when it comes to time limitations, healthcare professionals may be concerned about the time limitations they have during these office visits with their patients or delaying cancer treatment. As information and support, healthcare professionals need more information and support on how to individualize their patients' fertility risks and options, and what current fertility preservation techniques are available and where they should refer their patients. They also might have concerns about the appropriateness of discussing fertility with particular patients. For example, those with a poor prognosis, or those who live at a low socioeconomic status, or those who may not be geographically located near available services. And then also, healthcare professionals may not feel they have enough information about the safety and efficacy of fertility preservation methods. And one example that comes to mind are women that are diagnosed with breast cancer that might have a hormone-sensitive cancer. Is it okay for them to go forward with fertility preservation knowing they will be exposed to medications that will stimulate their hormones? One of those that I had mentioned were the costs associated with family building options. They're extremely expensive, and they can definitely be a barrier, especially when cancer patients are already faced with medical bills after medical bills and in need of financial assistance programs. They're especially expensive for women, and these procedures are generally not covered by insurance companies. So last year, we did an analysis of the existing costs kind of all over the U.S. with information that we had available, and pulled information from other areas about what the average costs we're seeing across the U.S. for these types of procedures. And you can see surrogacy is extremely expensive, and there really aren't a lot of financial assistance programs out there for that. With the barriers in mind, there's also solutions in mind. The valid concerns can always be addressed by developing procedures and gathering educational resources to equip clinical staff, such as nurses, to provide timely and accurate fertility information to patients. These procedures should include tools and resources that help healthcare professionals adequately inform their patients. So in 3 parts, there's disclosing risks. So based on cancer type and treatment, are these individuals going to be at risk of becoming infertile? Informing of options. So informing patients of all options available to them, and then also making referrals to specialists and to support services. Over the years, the medical community has taken action to provide fertility preservation guidelines for this end. There have been several steps since 2004 that have taken, and so starting back in 2004, there was the President's Cancer Panel that produced the report on survivorship, which listed infertility as a top concern and issued recommendations. In 2004, also, ASRM created a fertility special interest group to address fertility preservation. And then more recently, in 2012, the National Comprehensive Cancer Network released AYA guidelines with fertility preservation recommendations. And then last year, the American Society of Clinical Oncology updated their fertility preservation guidelines, which they originally produced in 2006. So let's discuss some of the fertility risks and tools available. LiveStrong offers tools to help healthcare professionals and patients understand their risks. This first is the fertility risk tool is something that LiveStrong has on our website that allows individuals to go in and put their cancer type and recommended treatment plan and determine if they're at a low, intermediate, or high risk of becoming infertile. There are at-a-glance risk charts that healthcare professionals can use in their office setting. And there's also, there are suggestions for providing patients with their fertility risks, that it's part of the duty of informed consent, that it's important to give timely notice to all eligible patients at the beginning of diagnosis, and to offer meaningful written and verbal information about a patient's reproductive risks. Informing patients of their fertility and family building options, healthcare professionals will need to be prepared to answer common patient questions, including, what are my options for preserving fertility? Will any of the fertility preservation options affect how well the cancer treatment works? Will using one of these options mean that I need to delay cancer treatment, and if so, for how long? And how will each option affect my health and health of my future treatment of children? And will fertility treatments or becoming pregnant increase the risk that cancer might return? The tools for informing patients of their options, LiveStrong has the risks tool, but we also have a family building options tool. So an individual can put in if they're pre or post treatment and determine what options might be available for them for family building, whether it's using their own eggs, embryos, or sperm, or whether it's using a donor's, or whether it's adoption or surrogacy. Being able to refer individuals to the appropriate resources and specialists is also important. There are common questions about maybe what clinical trials are open to this client and where to find supportive information about fertility preservation. You could direct clients to livestrong.org/wecanhelp, or to even livestrong.org/fertility, where we have a fertility resource guide that's a searchable database of doctors and tools. And this is actually a very helpful tool, and it will be relaunched in the next coming months and will be even better and user-friendly, but they can search for resources for financial assistance or adoption, or fertility centers that are willing to offer discounted rates. On our We Can Help website, patients can educate themselves and read articles and watch videos. Through our fertility services, they can get one-on-one fertility guidance. They can get connections to fertility centers that participate in our program that I'm going to talk about next. They can get education and support. So one of the main programs of LiveStrong Fertility is our program for men and women, and this helps address the barrier of the financial expenses related to fertility preservation by helping individuals get a discounted rate. So LiveStrong, the foundation, acquired Fertile Hope back in 2009, and also one of the pieces of that was the Sharing Hope program that networked with fertility centers to provide discounted rates to patients undergoing fertility preservation. So that's still a very popular program that we're working with, and we now currently have almost 400 fertility clinics across the U.S. that are participants in our program that will offer a discount. We have a partnership with EMB Serono to provide women with a free round of fertility medications. And we have an application process, eligibility criteria to make sure an individual is in financial need. And if they qualify, then they get the discount on the services and also the free medications. So the next few slides, I'm going to talk about some of the results that we found from a study that we did about this our LiveStrong Fertility program and how that's helped cancer patients. We did notice an economic impact. So almost 80% found that LiveStrong Fertility reduced the financial barrier and allowed these individuals to go forward with preservation. This is a result of the various groups collaborating together, so the fertility centers, the support of EMB Serono, the pharmaceutical company, and also with LiveStrong reviewing and educating on the program and talking to clients and taking care of the application side of things. We also looked into the emotional impact that the program had. 88% felt a decreased level of distress regarding fertility options after using LiveStrong Fertility services. 87% felt an increased feeling of optimism regarding parenthood options after using LiveStrong Fertility. And we included a quote here: "Livestrong's financial help allowed my husband and I the opportunity to preserve our chances of starting a family. This made my cancer diagnosis less upsetting by giving us hope." We always ask our clients to stay in touch with us because we love to hear their stories, and we love to share them internally, just their stories of hopes, and especially when they go back to use their eggs, embryos, and sperm and they're building their own families. It's just a very rewarding experience. So the important piece of that I would like to highlight is just the collaboration that happens between different groups involved. And so knowing that working together with oncologists, the reproductive endocrinologists, different nonprofit groups, the pharma companies, we can open up as many family building options as possible for those that are fighting to live. I wanted to go ahead and also show Aaron's story, which is another client that we've worked with, and he's got a great story to share.
Great. So just another reminder while I get this set up, you can either listen to this through your phone or your computer speakers, but if you listen through both, then you might get some feedback.
I noticed a painless lump in my groin, and in typical male fashion kind of ignored it for about 4 months. Finally, my girlfriend helped convince me to go into the doctor. My general practitioner tested me for everything from cancer to cat scratch fever, and about 2 days before Thanksgiving, I got a call from my surgeon saying that I had Hodgkin's lymphoma. My girlfriend came over instantly, and we sat together on my couch and cried together. Alice and I had been dating for about a year at that point. When you're trying to figure out each other and what the future looks like, having something so big into your life is extremely scary. I think I said something along the lines of, I understand if, you want to leave. It was a tense moment because I didn't know how exactly she would react. I think she thought that was preposterous, which was great for me to hear, right? I wanted her to stick around. I really wanted her to be with me. I really like to know how things work. I'm a very research-oriented person. I wanted to find out as much information as I possibly could about cancer. So hopped on the internet, and I continually wound up at livestrong.org. I found some information saying that my fertility could be extremely affected by chemotherapy. We hadn't had that conversation about wanting to have kids or not wanting to have kids yet. I guess my cancer diagnosis forced us to talk about the future in a way that I didn't expect it to. I reached out to Livestrong through a phone call. I made an appointment to go in and speak with one of the navigators. And she and I spoke about fertility preservation. It was a lot more simple than I thought it would be. I felt like I was taking control at that point. Since I've finished up with treatment, Allison and I got engaged. We talk about what the future holds. We're really excited about starting a family together, and I know that I can do that now.
Thanks, Anne. So I wanted to take the time to see if anyone had any questions about any of these things that we've talked about today, or any of Livestrong services through the fertility or navigation. I'm happy to answer them.
So just to remind folks, if you want to use the Q&A feature that's on the right side of your screen to ask a question. I do have one question, Ashley. How was the risk assessment tool developed?
It was developed using some of our medical experts and fertility experts in the field. It is something that has been existing with Fertile Hope since the beginning, probably 2004, and it's something that we've recently gone in and updated that information. So it is reviewed by medical experts in oncology and reproductive, and were also reviewed by reproductive teams.
All right, so if anybody has any questions, again, you can use the Q&A box that's on the right side of your screen. So Ashley, could you talk again about the assessment tool and what factors it takes into consideration?
Sure. So we have the two different tools that I mentioned were the risk tool, and then also the family buildings options tool. So the risk tool, you can go in and you can select your cancer type and your treatment type. So you could select if you were diagnosed with breast cancer and you were having chemotherapy or radiation. You could actually put in the different combination of chemo drugs that you are going to be receiving, and then from that you would receive a breakdown whether your fertility is at low, it's a low risk, it's an unknown risk, intermediate, or high risk of becoming infertile. And so that's based on the information that we have about the drugs, or knowing that radiation, especially if done in the reproductive area, that those could cause issues or an impact on your fertility. So that's the risk tool, and that's very helpful. We actually direct a lot of clients to it if they call us and they're newly diagnosed and they haven't had this conversation yet. Then we say, okay, well, if they ask about a particular drug, then we'll say, well, why don't you look at the risk tool that we have available online, and we'll send them there, and they can look themselves. Or it's a tool also that can be used by nurses or oncologists that might not have a lot of information about the impact of the drug on their fertility. They can also use this as a tool to help them in those conversations. And then the other tool that I had mentioned was the family building options tool. So here it takes into consideration if you're female or male, if you're pre or post treatment, if you have already been through puberty or if you have not. And then after you fill out that section, then it will populate the options that are available to you. So for women that might be post-treatment, there's still a possibility that they could preserve, especially if they are at risk for early menopause. If there aren't, for men or for women, if their fertility has already been compromised based on their selections, then they're still going to pull up options such as adoption or surrogacy, or using donor eggs, embryos, or sperm. And so that's also a helpful tool that we can review with clients when they call us, or it's a tool that can be used with healthcare professionals.
Great, thanks. So it looks like we have a couple more questions. One is, when will the male/female fertility preservation options or guidelines be updated?
The options were just the options that we have on LiveStrong's website?
I'm not sure.
Okay. The options that we just did a review of the risks and the options in 2013, and so that information is up to date from last summer. And then we provided the risk charts actually for ASCO's update that they did, their fertility preservation guidelines. The chart in there on the risks, those come from our risk charts, and so those are available on our, they will be available soon on our website, the updated versions.
Great, and just to confirm, the person asking that said they're talking about the option posted on Fertile Hope, but it looks like that answered that question. So then next question, does Livestrong provide support to patients from Canada?
We have our fertility program right now is only in the United States. We do have a few resources that we're aware of in Canada. As far as our navigation services, it's very similar. A lot of our partnerships are within the United States, but we do still have some resources that we're aware of in Canada that we can help individuals locate. But the fertility program and the discount program is, right now, it's just in the United States.
Okay. We have another question. How long does it take to get in touch with a fertility navigator? Is there a wait time involved?
There is not a wait time involved. So There's two different possibilities. We have our fertility team spends a lot of their time talking to clients that have already applied for our discount program. We have our general navigators that are also able to do general fertility education or to help connect them with someone on the fertility team or someone on our emotional support team if they're looking for counseling. The turnaround time, they should be able to get in touch with someone in the same day. The problems that we run into is mostly if they call us and if they have to leave a message and we call them back and there might be a little bit of phone tag, but it shouldn't be more than 1 to 2 business days. And for the LiveStrong Fertility Program, if they are applying for the program and hopes to get a discounted rate, once we receive a completed application, it's a 1 to 2 day turnaround time. And we do realize that a lot of these cases and clients that are wanting to preserve, it's very time sensitive, and so we do have a lot of urgent cases come through, and we do our best to do a same-day approval if possible. With clients that submit pieces of their application and it's not complete, maybe we're waiting on the oncologist form, we do try to touch base with clients once a week just to kind of help facilitate them through the application process and just make it as smooth and seamless as possible just because we know that they're already faced with so many other things and have a lot going on. So, but we do our best to approve clients within 1 to 2 days.
Great. I don't see any other questions in the queue, so if you have something, type it in quickly and we'll give another couple of seconds.
I would like to, Anne, if it's okay, I'll mention one more thing. For anyone that's working with clients that are post-treatment that might be at risk for early menopause that did not preserve prior to treatment, we are working on a program, hopefully launching it in the next 2 weeks, that will help women in this situation get access to medications and hopefully discounted rates. And so if you do have anyone in that situation, then please reach out to me and or have your client reach out to me, and I'd be happy to let them know when the program does become available.
And will information about that be on the same page as information about the other programs that you talked about?
Well, this program is actually a pilot program, so we're just piloting it for 2014 with the support of EMD Serono to see what it looks like and how it works and how many clients are actually reaching out to us for this. And so it will not be available on our website, but we've seen just increasing numbers and calls from women that are interested in these services, and so our team will educate on it, and then also with the help of nurses that we know in the field, and I'll send it out to some of our contacts and colleagues through our fertility program.
Great. Well, that sounds exciting.
It's very exciting. We already have 5 women in the queue that are waiting patiently to get it up and running.
Great. That is fantastic. So I don't see any other questions, but I wanted to thank you, Ashley. That was a great overview of LiveStrong Fertility, a lot of great information. Oh, hold on. It looks like we have one. So somebody asked if there's any assistance for the breast cancer community.
Yes, so our LiveStrong Fertility program is open to anyone diagnosed with any type of cancer. So we see a lot of breast cancer patients that come through our program to get support, to get the discounted rate, and to get the free medications. So yes, there's absolutely support for any cancer type.
Oh, hold on. So not for treatment, but for proactive procedures. So I think you mean before treatment would begin, to the person who is asking the question? So at cancer diagnosis, what you're asking? For the person who asked that, if you could just provide a little bit more detail, there's a new question, and then we'll come back to that one. Is there any psychological help for people with infertility?
Yes, there are resources available. We also are hoping to be able to offer that at LiveStrong from our counseling support staff that we have here for free for individuals that need help. That's also something that we're working on and hope to have up and running by this summer. But if someone contacts us, and we do have counselors that do focus in these areas that we could make referrals to or help an individual find the right information. Really great centers, oncology centers that have fertility preservation systems already in place. For example, Northwestern has a great system. They also encourage or have their clients go through counseling prior to preservation. So some centers do offer it on site, and those that don't, we want to be able to offer those services because there is a growing demand for it. So I hope that's something that will be integrated soon into our counseling services, but until then we can help locate support groups or counselors or individuals that can help with that.
Great, and we got some clarification on the last question. So if somebody, it looks like, has one of the BRCA genes and chooses to have their ovaries removed before possibly getting cancer, is there fertility assistance for that community?
That is a great question, and so they can still submit their applications. The difference for this community is that they would need to provide a letter of medical necessity from their oncologist stating that they're at a high risk of cancer and that the oncologist is encouraging that they go forward with fertility preservation and to have their ovaries removed. And so it's a case-by-case basis, and they just need to go ahead and reach out to us and talk to us about it and provide some additional medical information and support from their doctors, and we can still review their cases.
Great. And then we had a question about a copy of the presentation. So yes, after the call, we will send out an email that will have a link to the recording, and we will send out a PDF of the slides, and then we will also send out an evaluation. Great. So I don't see any other questions. So again, thank you, Ashley. This was fantastic. We just had a participant write in that this was fantastic. So thank you so much, Ashley. Thank you all for being part of the presentation. I just wanted to put up a slide again about some of our free CA-SNAP resources. And thank you so much, and we hope that you will join us again for our next webinar.
Thank you.